Hello, my name is Priscilla Sano, and I am with Grand Canyon University. In today's topic of discussion, I will be covering the bacterium called Staphylococcus aureus. We will be covering quite a few objectives today. First and foremost, the name and structure of the organism, the scientists who discovered the bacteria, lab characteristics, taxonomy, bacterium characteristics, pathogenesis, breaching the first line of defense, which is the skin, infections that are caused, epidemiology, treatment options, depending on whether the infection is severe or not severe, alternative therapies, prevention, and last but not least, prophylactics. Name and structure. Staphylococcus aureus is a gram-positive bacteria. Now, what that means is when it goes through the whole gram staining process, visually and microscopically, we can see that the colonies will be purple in color. All gram-positive bacteria will be purple in color, whereas gram-negative bacteria end up appearing a red to a pinkish color. So as stated, it is a gram-positive bacteria that appears purple. It is also cocci-shaped and found in clusters. Cocci shape means that it's going to be circular, and this visual shows a great representation of it being found in clusters where colonies are aggregating together. S. aureus also possesses a smooth surface, and it has a very small diameter of about 0.5 to 1 micrometers. It's also known for having a very thick cell wall. The scientists who discovered the bacteria. So S. aureus was first described by a Scottish surgeon in 1880 by the name of Sir Alexander Oxton. He recovered the bacteria from a knee joints surgical pus from a patient, and he described it as looking like grape bunches. In 1884, we have a German doctor by the name of Frederick Julius Rosenbach, and he differentiated it by its golden color, which is shown in this visual. Laboratory characteristics. The bacterium is aerobic and also is considered to be a facultative anaerobe. It forms yellow colonies on media that are made from the bacterium's carotenoids. In blood agar specifically, hemolysis will be noted. So when we have the red blood agar plate and we have the individual yellow colonies growing, around the yellow colonies, you'll have a clearing where it appears with no red coloration. So that's where hemolysis will be found. And there are various types, such as alpha hemolysis and beta hemolysis. S. aureus is also able to grow in high salt concentrations, specifically at the most about a 7.5% salt concentration. It is also coagulase positive, and if you look at the visual right here, it's a comparison of Staphylococcus epidermidis and Staphylococcus aureus. If an organism is coagulase negative, then the liquid will stay a liquid, whereas Staph aureus will form somewhat of a clot. Now, Staph aureus is also catalase positive and oxidase negative, so those results are also noted with this bacterium. Taxonomy. It belongs to the kingdom Bacteria, subkingdom Poxibacteria, phylum Firmicutes, class Bacilli, order Bacillales, family Staphylococcaceae, genus Staphylococcus, and last but not least, species will be Staphylococcus aureus. Characteristics. S. aureus is quite versatile. It can be carried in healthy individuals in the nasal cavity. It is said that about 25 to 30% of the population ends up carrying this bacterium in their nasal cavity, and it doesn't necessarily pose a threat. The bacterium may also be an opportunistic pathogen. Now, it is mainly known for causing skin and soft tissue infections. And it can also cause infections that may be very life-threatening, especially if we're dealing with the resistant strains such as methicillin-resistant Staphylococcus aureus or MRSA. Pathogenesis. Now, S. aureus may survive for months on surfaces, and its cell wall is also lysozyme resistant. The yellow color it produces protects it against the sunlight's UV rays. S. aureus also has 300,000 more base pairs than other Staphylococcus species, and that is mainly due to the virulence factors and ways in which it can circumvent the host immunity. It forms coagulase and damaging toxins responsible for spreading the infection, destroying tissue, or may prove lethal to host defenses. The bacteria may be spread throughout the blood, causing sepsis, or it may produce enterotoxins that cause major issues in the gastrointestinal tract. Reaching the first line of defense. So if S. aureus is able to penetrate the skin, inflammation will be the very first thing that occurs. And then the recruitment of macrophages and neutrophils will come to that specific damaged site. Now, the bacterium in turn will release a protein that will start to block neutrophils from actually getting to the infection site. And if some of those phagocytic cells do make it to the bacterium, a toxin can be released, and that will end up killing the immune cells. Pathogenesis continued. It will resist opsonization, so it will not be tagged for phagocytes to be able to recognize it for elimination. Now, sometimes the bacterium is able to survive this tagging, and other times it may not. So if it happens to be tagged, it can survive inside of the phagosome as well. S. aureus may show its superantigen side, causing a serious immune response. The T cells affected will release large amounts of cytokines, and that causes many things such as fever, nausea, vomiting, diarrhea, shock, and death can actually occur, and that's caused by food poisoning and toxic shock syndrome. The bacteria may also evade adaptive immunity altogether. Infections caused. So Staph aureus is known for causing, minimal type of infections and those types of infections that are completely resistant. So little things such as folliculitis, such as a pimple or maybe a sty in the eye, can be caused by the bacterium. Abscesses also can be formed, and those are very difficult to treat with antibiotics. A carbuncle can form, causing a deep skin infection, and that will also present with fever and illness. Scalded skin syndrome can be caused by toxins A or B. Toxic shock syndrome may start with fever, vomiting, rash, shock, and it can lead to organ failure. More commonly, the kidneys tend to be affected more so. And this will all be caused by toxic shock syndrome, toxin 1. The bacteria may also cause more prominent type of infections such as endocarditis, pneumonia, cellulitis, and osteomyelitis. Epidemiology. S. aureus bacteremia is spread within hospitals and inpatients. People with HIV are going to be 24 times more likely to develop an infection than HIV negative people. Hemodialysis patients are more prone to these types of infections due to their catheters. Diabetic patients are also at a higher risk of developing staph infections. Age is also a risk factor, and usually it tends to affect early infancy patients and also patients that are greater than 70 years of age. In the US, ethnicity is a contributing factor where the Black population is more prevalent or more prone to contract these types of infections than the white population. Males are also more prevalent to infection than females. If there are injection drug users, they also have an increased chance of developing an infection due to Staph aureus. Treatment. If the infection is cutaneous, then drainage is going to be the very first thing that should be done. They try to drain it because these type of infections tend to be somewhat resistant when treating them with antibiotics. So they try to go ahead and get out much of the bacteria and clean it out and then treat it with antibiotics. So if the infection is going to be minor, they're going to treat it with certain types of antibiotics, such as trimethoprim sulfamethoxazole, clindamycin, doxycycline, or minocycline. Now, if it tends to be a more serious infection, these types of infections are not going to respond very well to incision and drainage alone. So with these complicated and resistant strains of S. aureus, vancomycin will probably be the more common type of drug that will be used, but it is toxic to the kidneys. So other options could be linezolid, daptomycin, telavancin, and also clindamycin will be the drugs of choice. Alternative therapies. So due to S. aureus being able to develop resistance quickly, it may be necessary to prevent infections. So the development of a vaccine against S. aureus molecules is on the forefront. Anti-HLA may protect against a recurrent infection. Antibodies such as HLA, COA, and BWBP protect against severe infections. Direct toxin neutralization or receptor blocking may moderate or prevent subsequent infections as well. Prevention. Prevention will always lie in which is the capacity of how the infection has been contracted. So to begin with, certain populations are predisposed to Staphylococcus infections, such as patients with diabetes mellitus, renal disease, and HIV. If it's carried by the individual nasally, then decolonization treatments may be useful. If the infection is obtained from healthcare workers, the environment, or other patients, the aim should be geared always towards improving hand hygiene. Prophylactics. So there have been various studies where certain types of patients have been treated with antibiotics post-surgically or because of other situations, and it's shown to actually reduce the amount of Staph aureus infections overall. So here we're going to cover some examples. Dialysis patients that carry the bacterium nasally receive the antibiotic mupirocin intranasally, and that reduced the number of infections. Dialysis patients were also treated with the antibiotic, but they're treated at their site of their catheterization. And that also showed a positive correlation in decreasing the staph infections. Nasal carriers undergoing major surgery received post-surgical mupirocin, and that protected against nosocomial infections. Some ICU patients also received treatment with this antibiotic along with chlorhexidine gluconate, and the incidence of infections were quite lower. Povidone iodine prophylaxis at catheter sites also showed a significant decrease in infections along with the treatment of this antibiotic specifically. So in review, we have covered the name and structure of Staphylococcus aureus, the scientist who discovered the bacterium, laboratory characteristics, taxonomy, bacterium characteristics, the pathogenesis, breaching the first line of defense, and what happens when that occurs, infections that are caused, and whether they are severe or non-severe, the epidemiology and certain populations that tend to be more affected than others, various treatment options depending on the severity of the infection or the resistance of the microbe, alternative therapies that are on the forefront, prevention tactics, and also prophylactics. And that comes with a combination of treatments with antibiotics, chlorhexidine gluconate, and povidone iodine. I hope you have enjoyed my presentation on Staphylococcus aureus. Thank you very much and have a great day.